I'm Professor Derick Raal from Johannesburg, South Africa, and I'm currently in Amsterdam attending the 2015 ISA meeting. I'm going to be talking about the TAUSSIG study, which is a study with the use of a PCSK9 inhibitor, Evolocumab, in patients with severe familial hypercholesterolaemia. And I'm talking about the subgroup of the study, which is the homozygous FH component. So this is the largest study reported today in homozygous FH patients, and 100 patients with homozygous FH have been enrolled into the TAUSSIG study. Now, in the TAUSSIG study, you could enroll into the study either as a follow-on from a Tesla study. That was a smaller study, only a 12-week study, where on average we showed about a 30% reduction in LDL cholesterol in these very difficult to treat homozygous FH patients. Or you could enroll de novo. So this study included patients that were just on maximum lipid-lowering therapy, statin plus ezetimibe, or were receiving apheresis. And in these 100 patients, the average reduction in LDL cholesterol was about 25%. This study was a longer-term study. It wasn't just 12 weeks like Tesla. And the reduction in LDL cholesterol in these patients was maintained up until week 48. So the effect was definitely maintained. Now, the effect in the LDL reduction in those patients receiving apheresis was slightly lower in those not receiving apheresis. But importantly, in the patients not receiving apheresis, we elected also to increase the dose of Evolocumab from 420 milligrams monthly to 420 milligrams given every fortnight, every 2 weeks. And increasing the dose to fortnightly dose resulted in a further 6% reduction in LDL cholesterol, which I think is clinically meaningful. So importantly, the effects were maintained for 48 weeks, and the drug was also found to be remarkably safe. There were no serious adverse events which were related to the study drug. There were serious adverse events related to the nature of homozygous FH, cardiovascular events, etc., but no deaths during the duration of the study. So I think this is an additional effective therapy in this very difficult to treat population. And on top of current best therapy, we can get another 20 to 25% reduction in LDL cholesterol.